Newfoundland and Labrador is on the precipice of opening its doors to the rest of the country, and the Atlantic bubble already started July 3rd. Up to this point, we've been one of the safest places on the planet in the fight against COVID-19. It's a common observation that perhaps because we've had such effective public health interventions and we're sheltered from any outbreaks, we may be becoming a bit complacent. In today's show, we'll speak with medical experts in 2 epicenters and then our own Chief Medical Officer, Dr. Janice Fitzgerald. With 3 health ministers since the start of the pandemic and leadership that does not promote public health protocols, Brazil's coronavirus cases have skyrocketed. But many believe Brazil should have been able to avoid this crisis. For a bit of background, Brazil has a public unified healthcare system which guarantees free access to all levels of healthcare services, from primary care to specialists for its citizens. In addition, over 25% of the population hold private health insurance, mostly through their employment. Professionals working in the healthcare system, including universities and public scientific institutions, have historically helped overcome crisis and produced sound public health responses, such as dealing with the Zika outbreak or the national responses to HIV and AIDS epidemics. Current statistics, though, show that Brazil has the world's second highest number of deaths from COVID-19 and bed occupancy rates of over 90% in 3 Brazilian states. So how did the country reach this point? Well, here to help explain the situation is Dr. Castro Lima. He's an infectious disease physician working at 2 hospitals in Sao Paulo, Brazil, largely regarded as the epicenter of the outbreak in the country. Welcome to the show, Dr. Castro Lima.
Hello, Mike. Thank you so much. It's a great pleasure for me talking here from Brazil to you and sharing our experience with you in Canada.
I really appreciate it. And I think that for the folks that are listening to the show, tell us a bit about Sao Paulo and the hospital settings that you work in.
Sao Paulo is the biggest city in Brazil. We have a population of 15 to 16 million people. And here we have a great number of hospitals, private hospitals and public hospitals. In Brazil, we have a very strong public health system, including the biggest hospital in South America that is called Hospital das Clínicas from University of Sao Paulo. Sao Paulo, as Brazil, have a great social difference. So we have some districts with very poor people and some districts with rich people. So we can see this difference in our health system also. So private hospitals that we have a good structure of equipment, of drugs and medicine, and other hospitals that don't have a good structure and with not a good health system. Sao Paulo is the first city in Brazil that have a case of COVID-19, and until today is the city with the highest number of cases. So it's a very important city in the context of the pandemic here in Brazil.
So the current status is Brazil globally right now is one of the most challenged countries. Are there parts of the country that are hit worst with this than other parts?
Yeah, Brazil is the second country in the world that has highest number of cases, almost 1.5 million cases and more than 60,000 deaths until today. It's interesting that Brazil is a very big country, so different areas and different regions of the country were affected in different ways. Like in the north, we have states that don't have a big population and don't have a good health system. So they have a great number of cases with a great impact in the health system, comparing with some states of the south that have much more people and have a good health system, but don't have so many cases of the COVID-19. It's just an example to show that different parts, depending of the number of people, the population of the state, the number of cases, and the structure of the health system of the state, we have great difference in the pandemic here in Brazil. Today, we are observing an stabilization of the number of cases in the cities that were more affected in the beginning of the pandemic, like Sao Paulo, like some states like Ceará, Amazonas, whereas in other states that were not so much affected in the beginning, like Minas Gerais and some states of southern Brazil, we are observing an increase in the number of cases. And probably the second wave, the famous second wave in Brazil, will involve these states that were not so much affected in the beginning.
And that's part of today's talk for us, is that we've been relatively unaffected while certain parts of Canada have been very affected. Areas like Ontario and Quebec have had cases in the tens of thousands, while we've had less than 1,000 in our area, significantly less than 1,000. And so, we may be facing some of these as we start to open up our province if we're not careful. One of the things that I've noticed in reporting is that a lot of countries are reporting increased case numbers among younger populations, people between 20 and 40 years old. Have you noticed any trends like this in the hospital cases you've seen?
During the pandemic, we expect to see cases in all people, elder people, younger people. So we have observed a high number of cases in younger people, but including people that need to be hospitalized and sometimes going to ICU. But here we did not observe a great number of critical cases, more severe cases in younger population. I think that that's another thing important to comment, that all the world testing more for COVID-19. So more diagnosis is being performed, and there are a lot of people and young people that predominantly have mild disease with mild symptoms. So I think that we are diagnosing the disease in this population, but not necessarily the disease is more severe in these people. In our vision, see some cases in younger people, but not severe cases in this population.
In the day-to-day, where you're working at two different hospitals, what does your typical day look like when you're working?
The typical day changed a lot with the COVID-19 pandemic. First of all, a lot of wards are separated exclusively for COVID-19 patients. They need to be isolated, and a lot of restricted rules were established to precautions with the patients. So if you would like to enter a COVID-19 area, you need to put a private cloth, you need to put a specific mask, like PFF2 mask, gloves, gowns, be protected. And this patient could not stay with other person, like familiar person, stay with him. It's not allowed to protect health professionals, to protect other people, and protect other patients. So we need to keep in touch along the day with the families of these patients. And it's important to remember the other patients that have other health problems that's not COVID-19. So oncological patients, patients that need to do a surgical procedure. We need to have precautions with these patients also. To these patients did not acquire COVID-19 in the hospital. So all the structure needs to be changed and need to be adapted with this new reality. We call the new normal for the hospitals.
That sounds like a hectic day, and I can understand that there's a chance of somebody coming in for some other procedure and acquiring COVID-19 if the hospital is inundated in the ICU with the cases. So it's definitely a risk for people. So why is it that Brazil would have higher cases than other countries, you think?
I think that Brazil had the opportunity to see how the epidemic occurred in China, in Europe, and in USA. And our authorities did not prepare the country for the epidemic. Our most important authorities did not give the real value for the great problem we are facing now. So I think This is one of the main reasons to see Brazil today in the second place in the world in the absolute number of the cases. I think that we were not prepared for the epidemics. People were not completely prepared and informed about the consequence of the epidemic, and now we are living, unfortunately, the consequence of it.
That's very scary. Okay, so, we've been a place that's been relatively untouched by it. People do not have a firsthand experience with it, and so we can be afraid sometimes that we get complacent and then we forget it's there. What advice would you give anybody in a place that's been safe so far to stay safe going forward?
Yeah, I think that we are living a second moment of the epidemics. And here in Brazil, we are seeing a lot of places with people going to the streets with no caution and with no care about the spreading of the virus and spreading the virus for other people. We need to have very cautious with this situation because it's not controlled. It's very probable. The probability to occur a second wave in different parts of the world are very big. Our health systems have a chance to go to collapse, and so we need to stay safe and to have all the methods to protect ourselves and other people that we care about them, to protect everybody.
Well, thank you so much for sharing your experience today, Dr. Castro Lima. We really appreciate you taking time out of your busy schedule to share your experience with us, and thank you very much for being on the show.
Oh, thank you so much, Mike. It was a pleasure for me to contribute, and good luck for all people in Canada, for you, and we stay safe, and we expect that we can overcome all the situation better and better than we were years later.
We'll be right back after this break. The state of Texas, and particularly Houston, is renowned for its hospitals and medical research. Texas, however, is losing its fight against the coronavirus. After only a 28-day shutdown starting late March, Governor Greg Abbott started reopening the state April 27th in an attempt to help the economy. These executive orders and state-level direction from Republican leaders often disagree with local guidelines in major cities, which were primarily Democratic. This led to confusion in the population and public health guidelines shifting as party lines took the lead. Texas cases have since spiked and created one of the U.S. epicenters and global hotspots for the virus. After a record 7,500 cases last Thursday, Texans were ordered to wear masks in public by the governor. He's also halted any further reopening, although the state is basically already reopened. With over 200,000 cases and an overburdened hospital system, we reached out to Mary Anne Phillips, who was born and raised in Colliers, Newfoundland. She's a clinical nurse manager in the Texas Medical Center.
Mary Anne, welcome to the show.
Thanks, Mike. Thanks for having me on today.
So I think you have a really interesting perspective about what's going on there. You're from Newfoundland, right?
Yes, I am. Born and raised in Colliers, Newfoundland.
And you moved down to the U.S. to do nursing and since have been working in Houston for a number of years, right?
Yes, yeah. I moved here back in 2012, and I've been nursing here ever since in Houston, Texas. I'm a clinical nurse manager in the postpartum unit of a high-risk hospital in the Texas Medical Center. And for those of you who don't know, the Texas Medical Center is the largest medical center in the world, so quite an awesome place to work. A lot going on here.
Actually, yeah, that's really important for people to understand. Like, Houston is renowned globally for its hospital system and medical research, right?
Yeah, absolutely. So we have a combination of private hospital systems as well as university-based hospital systems. I believe, if my memory serves me correctly, we have about 168 to 170 hospitals/clinics in the Texas Medical Center. So you can imagine how much we see and do here in the run of a day. So it's quite amazing.
Wow. I've spent a lot of time in Houston. I think a lot of Newfoundlanders have close ties to Houston from the oil and gas side of things, so it's something that's pretty familiar. But it's hitting close to home. Can you explain what's going on with the COVID-19 situation there?
Well, honestly, we thought we were doing pretty good here in the Houston area. Given we're such a large city in the United States, we were doing pretty good, actually. We were averaging probably about 200 cases a day in Houston and surrounding area, which, considering the size of the city, that wasn't too bad. And then since Memorial Day, we've tenfold. We're about 2,000 cases a day now in the Houston area. So quite a significant increase. Not where we want to be, that's for sure. So that's why it's so important to talk about, mask wearing, social distancing, washing your hands. All those things are so important, because I think, honestly, we let our guard down, and this is where we're at right now, and it's really not a great place to be.
Well, there was some confusion, though, because I think that your governor was saying one thing and then the municipalities were saying another, and so public health guidelines were getting a little bit clouded for people, and you guys ended up having 7,500 cases in one day in Texas. So they've changed again. Like they've been very dynamic. Can you explain what's sort of been the root of that confusion?
I think, honestly, Mike, like I said, we became very lax. We thought we were in the clear. I think businesses started opening up, which was great, but I just think we needed to have stricter guidelines in place for mask wearing and social distancing, because now we've totally gone back to our restaurants being closed back down to 50% from 70%. All of our bars are now closed again. We have a mandatory mask mandate where we should wear masks anywhere in public. So all of these things, and social distancing, of course, and hand washing, so all of these things have had to come back in full effect due to the increase in these cases that we're seeing. And like I said, at Memorial Day, we had the city opening back up, we had our protests. So all of these things together, I think, just contributed to this crazy increase that we're seeing right now. And so once again, I can't stress enough how important it is to, wear masks, social distancing, because that is really the only way we're going to slow this spread.
Yeah, I think that, the public health guidelines have come out, and it comes down to people to be able to follow them. It's just, so when you're looking at the cases, everybody thought for a long time it was only going to affect the elderly. Are you seeing a difference in demographics? Are you seeing people of all ages being admitted to the hospital or having repercussions from COVID-19?
Most definitely, Mike. I mean, honestly, COVID-19 has no barriers. I mean, it's attacking everybody. I mean, honestly, the young, old, healthy, sick, pregnant, non-pregnant children, I mean, it is affecting everybody. So that's the other thing to remember. Just because you're young and you're healthy, you're not invincible to this disease. It's attacking everybody, and it's so new, and there's so many unknowns that we just don't know how it's going to affect you and what the long-term effects are going to be. So once again, it's so important to remember to practice all those safety precautions, because just because you're young and healthy and you think, oh, well, if I get it, I may just have a couple of symptoms or none at all, and it'll be all good. We just don't know how it's going to affect you. It affects everybody differently, different types of symptoms, different types of outcomes, so you can't be careful enough.
And across the community, I guess that's the big point of this now, is that you're seeing a place where people are adhering to public health guidelines on different levels. And Newfoundland is opening the Atlantic bubble now, and then potentially even opening up to the rest of the country in the next little while. Any advice you give people? We've got alignment between our government and our public health policies, but what should people really know about this after you've seen the reality of what the pandemic looks like firsthand?
Like I said, Mike, I can't stress enough. I understand, businesses have to open. I fully support that and understand that, but you have to be careful. I mean, as an individual going to these businesses, you have to take precautions, even if those businesses don't have certain rules in effect. I would caution everybody, please wear a mask, social distance, wash your hands. We were doing so well here, and everybody kind of let their guard down, and now you can see where we're at. So it's not just protecting, yourself, it's protecting others, because a lot of the cases that we do see across the community are asymptomatic people who are spreading it. So they're not even sick, and they're spreading it to others. So you just don't know who's positive and who's not. So once again, I can't caution enough to wear your mask, social distancing as much as possible, and not just in public around strangers, around your own family and friends, because honestly, unless you know who every single person has been in contact with, there's no way to know if you're not exposed to the virus. So once again, protect yourself for sure.
Well, that's great advice. I think it means extra coming from a Newfoundlander who's in a place that's one of the epicenters of the pandemic globally right now. And if you're seeing that, and that's the advice you're giving, then hopefully we all pay attention to it, heed it, so that we can avoid making the same mistakes that maybe some of the communities made in your area.
You guys are at a place right now where I feel like you're ahead of the game. You have the opportunity to make these changes and follow these practices and help decrease the risk of this spreading, because honestly, it can happen overnight, that it just spirals out of control. So while you have the chance, I would strongly encourage everybody to follow the proper precautions and just protect yourselves and one another.
Well, thank you so much for taking the time. I know you've been really busy down there trying to deal with all of this, but it's awful nice to hear from somebody from back home who's in that situation. So thank you so much.
Absolutely. It's been a pleasure talking to you today, and I hope everybody stays safe there.
Awesome. We'll do our best.
When we come back, I'll be talking one-on-one with Newfoundland and Labrador's Chief Medical Officer, Dr. Janice Fitzgerald, to see how COVID-19 is impacting us right here at home. The women who are Canada's chief medical officers and are leading our response to the rapidly changing COVID-19 pandemic have been described as fierce advocates for public health with calm, expert, compassionate dispositions that increases their ability to influence change. We're very lucky to have Dr. Janice Fitzgerald at the helm here in Newfoundland and Labrador. We sat down for a one-on-one conversation to talk about the pandemic so far, what we need to do as citizens, and what we can expect over the coming months here at home. So welcome to the show, Dr. Fitzgerald.
Thank you for having me.
So I think people have an increased awareness of your role. You know, the entire province looks to you for guidance. You start every news conference and people hear all the new public health guidelines from you. So what is the role of a chief medical officer?
So, by and large, a Chief Medical Officer of Health is really the physician in the province that is responsible for looking after the health and safety of the population. So that can be in many different aspects of health. It doesn't have to be just with regard to infectious diseases, although that's where we tend to get the most traction. So my job is to provide advice and guidance to officials who make the laws and rules, and as well as to provide advice to other entities that may need that advice. And in addition to that, we monitor the population, we do assessments to look at the health of the population, and we conduct surveillance to see are there areas of concern with regard to health. So we also have surveillance for infectious diseases. So we do a lot in public health, and the Chief Medical Officer of Health basically is the person who oversees that whole function of public health. And so our responsibility is basically to find inequities, to find disparities, to find concerns about health, and then to bring those concerns to the people who can help us ask why that's happening, and then bring it to the people who might be able to do something about it to make it better.
So your role has obviously changed with the pandemic. Because I think that a lot of people wouldn't have known the full scope of everything, but how has it changed now that we're dealing with this?
Well, certainly with the pandemic, of course, we've become much more focused on dealing with one particular infectious disease that we've never seen before and that we're still learning a lot about. And so certainly we've taken a very communicable disease control slant to the job, and that's what most people are seeing me do all the time, is trying to find ways to control that communicable disease. So a lot of the orders that we've had to implement, the fact that we implemented a public health emergency, that's not something that we've ever had to do before, that we've ever done before, and thankfully we have this new legislation that allowed us to do it this time. But that's a very different role, I think, than we've seen the Chief Medical Officer of Health have in the past. But in addition to that, though, there's still a lot of things that we have to, public health is still going on, and there's lots of other things with healthcare that are still happening that we have to keep track of. So we are still following up on all of that. And in addition, we're also going to have to look at a lot of the unintended consequences that came from some of these measures that we put in place. And we recognize that that is something that we will have to look at and try to minimize as much as possible as we go forward, because we're still not out of the woods yet with regard to the pandemic itself. So.
Right. So now that we've had a plan in place, there'll obviously be additional surveillance going forward and additional planning. How do you guys tackle that as a department?
So our public health team which is an incredibly efficient and wonderful team. It's small, but it's worked really, really hard through all of this, and I can't give them enough credit, honestly. So the team has gotten together, and we do have conversations on a federal, provincial, territorial level, so we're meeting regularly with counterparts across the country, and there are, recommendations that come from that group with regard to surveillance and how we should look at that. So we have a surveillance plan in place based on that those recommendations from the Public Health Agency of Canada and the Special Advisory Committee. So we've developed our surveillance plan based on that. So we are going to be looking at several different indicators with regard to not just how many cases of COVID-19 we see or how quickly new cases are developing or anything like that, but we're also looking at indicators that tell us how well our contact tracing is working, how much contact tracing we're able to do, how quickly, what's our turnaround time on tests, how quickly can we identify people, what's our capacity for ICU and for personal protective equipment, PPE. So there's lots of indicators that we're using to try to help us decide what we need to do with regard to keeping things open or closing things and what our actions have to be. So.
Right. Not only how is the transmission of the disease, but also how capable are we of being able to protect.
Responding. Yeah. Right, exactly.
So that's another question I think people have had. I think the shutdown, people understand the shutdown was required to sort of flatten the curve, of course. But were there other measures or other reasons why a shutdown would be necessary, like educating the public or prepping the medical system? What else was occurring besides stopping the transmission person to person?
Right, and yeah, that's a great question, because there was a lot of things that were happening besides that shutdown. I mean, people see what happens to them personally, but they don't necessarily see what happens at the bigger picture. And yes, so we were preparing our medical system to be able to, our healthcare system to be able to deal with that. So we had to reduce bed usage to make sure that we had the capacity to deal with an increase in cases should that happen. Thankfully, we were lucky here, and so we didn't run into overcapacity. But that's not to say that couldn't happen again, and if we see a surge in the fall, that we could get close, So all of that was going on. All the regional health authorities were working to make sure that they had enough capacity. There was a lot of work being done to make sure that people who were in vulnerable situations were protected. So remote communities, people who use shelters or are precariously housed, people in other vulnerable situations, that they were going to be able to be protected and identified should they develop cases, and then what do we do with those, where do they go in situations, especially if they're precariously housed. So all of those kind of planning things were happening. And additionally, of course, we did want to reduce the number of people who were out and about and interacting with each other, because we knew that the more interactions you have with people, the greater the chance there is for spread of this. And really the only way to do that was to stop the movement of people, and that's what this accomplished. And I think it gave people time, and companies and businesses and governments and everybody time to sort of get their heads around how are we going to approach this in the days and months and hopefully not too many years to come. But, certainly within the next 12 to 18 months, we're all going to have to think about how we do this differently. And I think that shutdown did give people time to adjust and adapt. And I think, there were unintended consequences, but there are also positive unintended consequences as well, and that some people realized that working from home is not terrible, and some companies realized that people could work effectively from home, and I think that's all could be positive in some ways. So.
Yeah, and even on the physical activity side, walking was up 46% across North America.
It was unbelievable, the difference I found. Just we walk in our neighborhood, and just the sheer number of people I actually saw walking around, it was really quite heartening to see. I thought, well, that's one positive that's come out of this. So hopefully people can keep it up.
That's right, and everybody knows how to cook sourdough.
Yeah.
So how do you work with the other chief medical officers across the country, and what's the importance of common messaging?
So back in the beginning, when all this started, we have what they call a Council of the Chief Medical Officers of Health, which meets once a month on a regular basis just to discuss some of the public health issues and concerns that are coming up across the country. So that's a regular thing that we do, and very useful and very helpful. And included in that, of course, is the Public Health Agency and Canada's Chief Public Health Officer, Dr. Tam, and Dr. New. So that sort of group is already in place. So what happens in a pandemic, if need be, so we have this all response plan, and if need be, a special advisory committee can be struck, which includes all of the chief medical officers of health and people from Health Canada and the Public Health Agency and other groups to that, and its focus is to actually look at the management of whatever the issue is. So there's one struck on the opioid crisis. There's also this one. And there's been other things in the past as well. So we now meet regularly. For a while we were meeting 3 times a week. Now we're meeting twice a week. And, we're focusing, at the moment, of course, we're focusing on reopening and long-term planning and what we're going to do in the future. That group also talked about shutting down and the measures we had to do for that. We talked about the reopening process and what had to be in place for that. And I'm sure once a vaccine becomes available, we're going to be talking about vaccines and how that rolls out. So that group meets regularly. We discuss things regularly. Common messaging is probably the priority, and that's the overriding communication of all of it, is that we've got to have some common messaging here. The public needs to be hearing the same thing. We're a huge country, and very different regionally, so we need to make sure that the message that's getting out there is the same. The basic message is the same. Obviously, there's going to be some local context to that. Even within our province, there has to be local context to that messaging, but right now it's really about the same messaging going out at all.
We'll be right back after this break.
Good afternoon, everyone, and welcome. I'm pleased to have our Chief Medical Officer with us again today. I will now turn it over to Dr. Fitzgerald for today's update.
Let's get back to our interview with Dr. Fitzgerald.
Why do you think we fared so well here? And then the second part of that, now that we have an Atlantic bubble, why is it necessary to open up an Atlantic bubble?
So I think we fared well here. There's a couple of things. I think people listened. I think we had the benefit of seeing things happen elsewhere in the country. Things tend to go west to east. The flu tends to come to the country west to east, starts in BC first. We're usually a couple of months behind before we see our big outbreaks. The same sort of thing happened here. And I think, so we had the benefit of seeing what happened in Ontario, seeing some of the things that happened in BC. And because of that, and because we were meeting regularly, we were able to learn from those experiences and to put some things in place based on some of the learnings that came from their experiences. So I think that's important. I think we did introduce self-isolation early. I think that made a difference, and not just because we knew in Newfoundland that while, yes, international travel was a risk, absolutely, as we started seeing cases increase in other areas of the country, we knew that a lot of our travel, if not most of it, was coming from other parts of the country, and so that's why we put self-isolation in place. And I think that certainly has had some benefit. We're lucky in that sense that we could do that. We're smaller, and it makes it a little bit easier in some ways, and we have limited ports of entry, I suppose, of course, right? So that makes a difference. So not to disparage any other province, bigger provinces, it will be much harder to implement some of the things like that. When we started reopening and we realized that importation risk was our biggest risk at that point, once we got things under control with our own outbreak here, that's when we thought we needed to put the travel restrictions in place to ensure the risk of importation was reduced. And obviously, when we put those travel restrictions in place, it was put in at a time when there were higher rates elsewhere in the country, and we knew that when we put that in, we were going to be watching those rates closely. We were going to be watching what was happening in the rest of the country closely, and when it changed to a point where we felt it was safe to lift those restrictions, then we would. So obviously, with Atlantic Canada, we're seeing certainly in over the last month and even longer for PEI, for example, there's been very few cases in each of the provinces, and I think that when we apply these measures that our Public Health Protection and Promotion Act, that's our act that we use to be able to put these special measures in place, that says that we have to apply these special measures in the least restrictive way possible. So if you don't have the evidence that supports keeping a measure in place, then you can't really keep a measure in place. So, looking at the Atlantic provinces and seeing what their rates of transmission were, it made it difficult to justify not allowing some travel between, because their risk was essentially as low as ours was, right? Mm-hmm. So, so that's why we allowed the Atlantic bubble. The chief medical officers of health had discussions about it beforehand. We provided our advice to the governments, and we've gotten to where we are right now. So.
Good. Okay, so one more question on the guidelines. We've been set up guidelines for each one of the different business units or sectors. How do you determine those? Are they based in best practices somewhere else? Like, I think that is clarity for people to understand, why do they have to go somewhere that's 50% full, for example, for a restaurant?
It's difficult because, I think people see how things apply to them, and it's not always having that benefit of the bigger picture. And so we look at, what's our risk, and I've said many times, it's people, space, time, and place. So the more people you see or are in contact with, the bigger your space and the more physical distancing is allowed is important. The more time you spend with somebody means that the risk is higher. So we want to keep our contacts as short as possible, and then outdoors versus indoors, right? So that is sort of the basis of our guidelines, and when we develop those guidelines, we base them on public health practice. We base them on some of the guidelines that that has been developed at this special advisory committee and the technical advisory committee that comes out of that. They provide advice and evidence about what's considered acceptable. We look to other jurisdictions and what they have done to see that we're maintaining consistency as well as much as we can across the provinces. And different provinces are in different places. There's different political milieus, and so all of that has to go into consideration when these decisions get made. It's not as simple as it's decision X and it's always X regardless of where you are, right? So there's a lot of things that go into consideration for why we might have something different than another province. But we try as much as possible to maintain consistency, and basic public health guidance goes into that. But then it's what people do with that guidance as well. So
that's actually the next point. As at the beginning of this show, we talked to an infectious disease expert in Brazil, and then we spoke to an ICU nurse in Texas. And in a lot of places, there is a divide between politics and public health. But Canada has actually been featured on CNN recently about how, regardless of party lines, public health has been helping guide the direction of the province. Now that we have this uniformity that allows consistency, what's the role of the public when it comes to their part going forward?
The public, I think, up to this point has been quite good at following what we need to do. And when we were in the throes of what was happening, when we had our big outbreak, and I think, I came on March 25th, I found my speaking notes from that day, the other day when I was cleaning off my desk, and that was the day that we announced 32 cases. And I remember, what a day that was. That was, we were, it was a bit nerve-wracking for everybody, I think. And it was early on. People were scared. And I think it was easier, I think, for people to do what needed to be done because there was that fear, because there was that unknown. Now we've been dealing with it a little bit more, and we're not seeing any cases. We've had not a lot of cases for a long time, and so people are thinking, okay, it's good, it's safe, and so we tend to let things slip and let things go a little bit. So we have closer contact than we normally would, or we see people who we wouldn't normally see, and it's hard to keep up that level of distancing and all of that we've been asking people to do. But it's not, you only have to look elsewhere in the world and south of our border, unfortunately, to see what can be happening with COVID, and it wouldn't take a lot to change for us here, for us to see something similar to that. And we don't want that to happen. So it's really important that the public still stay vigilant when it comes to washing your hands, maintaining physical distancing, making sure that you keep your number of contacts outside of your household and your bubble as low as possible, wear a mask when you're out in public and you can't physically distance. All of those things are still so vitally important for keeping this virus at bay, and it's really important for the public to understand that even though we're at a period of low prevalence right now, that could change, and this is your time to learn how to do all that stuff well without while we're in that period of low prevalence, right? Practice wearing your mask going out in public. How do I do this? So, when you're in a time when it is more important to do that, which almost certainly will happen. I don't want to be, the bearer of bad news or Debbie Downer or whatever, but it's almost certainly that we're going to see this again. So we do have to be prepared that that's going to happen, and the more you get used to doing these things now, the better prepared you'll be to deal with them.
Habits take a long time to form.
Yeah, they absolutely do, and we need to normalize that. Wearing a mask on the bus.
Yeah.
And wearing a mask when you're out at the store and it's a little crowded. If it's not crowded, if you're able to maintain physical distancing at this point, we would say that's okay, and that's why we haven't mandated masks. But and I know that's a question that people ask a lot. But I think there could come a time when people have to wear their mask when they're out in public, because if we don't, then the option may be that we have to do something similar to what we did before when we locked down. And we don't want to have to go there if we can avoid it.
So Dr. Fitzgerald, why is it important that we all do our part?
Because it's not going to work if we don't all do our part, quite simply. We all have a role to play in making sure that COVID-19 is contained within our province and within our country. We want to be able to keep things open. We want life to be able to go on as much as possible within the bounds of this, what this virus has done to us, I suppose, as a society. But I think if we don't all have that part to play, or if we don't all play our part, it's going to be very difficult for us to contain the spread of this virus. And so I think it is important for us all to do our part as much as we possibly can. I recognize that, not everybody has the same ability to be able to do things that need to be done, but as much as possible. And, public health wants to support people as much as possible in their actions, and to try to make the right choice, the easy choice, as much as possible. It is important to try to adhere to the guidance as much as possible.
It's such an important message. Is there anything you'd want to leave the audience with as we sort of clue up our chat?
For those Newfoundlanders and Labradorians who are listening, I want to first of all say thank you for listening to public health and for following the guidance and continuing to do so. To business owners and sports teams and all of these groups who have been diligent in trying to follow the guidelines as best as they can. It has been very important, and I know it's been a really, really long road, and that people are tired, and this is getting on their last nerve. I do get it, and so to that people are continuing to abide by those guidelines is incredible. So I really do want to thank people and to say that unfortunately this fight is not over, and we are still in it. We still need to follow those guidelines, and we will for the foreseeable future. But that we've learned a lot, and our health system capacity is good and can respond. And so we don't need to live in fear. We just need to live armed with the knowledge that, now we have science and experience to support us. And if we keep following those guidelines, I think we'll do okay.
That's great. Well, thank you to you and your team for all the work you're doing, and thanks for taking the time to chat with us today.
Thank you.
Over the last few days, President Bolsonaro, who has consistently downplayed the severity of the pandemic, has tested positive for COVID-19. And, despite the surge in cases in the USA, President Trump is pressuring governors to open schools in the fall while continuing to ignore public health advice, going so far as to hold additional campaign rallies for his supporters. In Canada, Ontario has mandated the use of masks in public, while discussions around potential mask mandates are ongoing across several provinces in our country. It's very clear this pandemic isn't over, even though we haven't felt its effects in Newfoundland and Labrador for over a month. I hope today's episode reminds us all to follow our public health guidelines so we can take care of each other, because that's what we do here in Newfoundland and Labrador. Today's show was produced and engineered by VOCM and Richard Sepka. I'm Dr. Mike Wall. We'll see you next week for another episode of the Health and Wellness Show on your VOCM.